to do more and more. Please, you have a question?
Quick, I was going to ask a question. I like the vision. I'm just wondering about lay partner, lay members. In practice, who are the lay partners? Are they just members of the public?
Yes.
Are they councillors? Are they commercial organisations?
No, good question. They are. The only criteria, like I said, is that they don't have a health service background. So they can't be doctors, they can't be health service managers.
Can they be health service providers, for example?
No. No. So what we're looking for and what we have are users. Sure. Now, some of them, for example, one member from here, Hammersmith and Fulham, is Jane Wilmot, who's a member of this committee. So some of them have, particularly in the Lay Partners Advisory Group, they have quite a lot of experience on things like Healthwatch. But we have no providers of healthcare. We have one or two people who work in the third sector, but actually on the advisory group we have none of those either. So we have people who work in Healthwatch. So we very carefully try to avoid people who suggest professionals in the area and have a vested interest. Exactly right.
Excuse me, can I just say something? For those who don't know Jane Wilmot, it's worth saying that she's profoundly deaf and was very active in the disability groups in the borough.
And actually, I didn't check before I started. There's nobody here because obviously when Jane's in the meetings, Jane Lippery's, but you have to be aware of it. Okay. Slide 4 just says that in order to make this happen, we are committing to do some things. So obviously there is some support that we need to give to some of the members, particularly the Lay Partner Forum. I'll just talk a little bit more about what North West London is doing to support what's happening in each of the boroughs. So if you look at 5, you'll see that there are 4 stages here, and and we can see that we're at the end of March 2014, start of April 2014, and that's just to give an idea of how far things have moved and what the timescales are. Actually, it's quite short here. The stage we're at the moment, from our perspective, the most exciting thing that our lay partners and our teams are getting involved with is something called the early adopters. And I'm going to say a little bit more about that in just one second. And that's the stage we're at, stage 3. North West London is has a pioneer status, which means it's moving slightly faster than other areas in the country. And I'm sure people say that has good and bad elements, indeed it does. But it's a recognition of the fact that they are, I think in this area, working together much better. So that's working together across health, social care, local authorities and big NHS providers and some of the third sector organisations. So that is beginning to work quite well. It's far, far from perfect. I think anybody here who's been involved will know that. But I think that's inevitable. The way they did the sections 1 and 2, if you look at slide 6, is to look at 5 big issues. So they were looking across the big area of North West London, trying to say, are there some things here that we should do across North West London rather than replicate 8 times in each of the boroughs? So all the boroughs signed up to this, all the CCGs signed up to this and worked on some of these issues. And you can see, for example, one of them is informatics, another one is commissioning financing, how the IT works across North West London. Ideally, we want it to work the same and equally well in all of North West London, because patients don't, stop at the edge of Hammersmith and Fulham and refuse to go any further. And you don't want to be ringing up from one hospital and saying, I can't access that IT system and see your patient notes. So everything we're talking about being able to access notes and have proper integrated care where, I can look at the patient in front of me. I'm not a doctor, obviously, but I can look at the patient in front of me and say, I see what all the people you've seen so far have said, and therefore I can treat you better and understand what's going on. All of those stem from having good informatics. So there are 5 issues there that they looked at for the first year across all of this, across all of the geographic region. And again, to emphasise, each of these groups had 2 of our lay partners on them. So this group, they vary in size, but about 10 people, of which 2 were lay partners. And their job there was to say, if you're going to do this, we need to co-design it from the beginning. You need to say, what we're doing this for. And they do this really, really well. They say, why are we doing this? What's the vision that we want at the end? What's the actual goal? Try to keep us on track about integrated care. We're really doing this because we want patient-centred integrated care, not because we want to have an informatics system that looks nice or that professionals love to use or that allows people to use their iPhones. We're doing it so it actually makes sense for the patients, and that's exactly what they do throughout this process. And I say it's working very, very well. Page 7, just a quick one about what we're trying to do with all that learning. There are two things here, 7 and 8 really talk about roughly the same kind of thing, which is that all of that information has been gathered together into a toolkit. It's actually a long paper toolkit, it's about 350 pages long with a big appendix. And then it's also on we're about to launch a website with it on. And the purpose of that is for all of the GP practices, all of the CCGs within our region to use it to improve the planning of their care. And the toolkit, like everything else I've said, was written with our lay partners involved in each and every stage of it. There is actually a chapter, chapter 3 is all about how to do co-production with lay partners rather than, build your services and then do some consultation. It's well worth a read. It's a good, that chapter, more than anything else, is well worth a read. There's also a couple of, we try to use, we're not trying to do all of this ourselves, we use resources where they make sense, we're not trying to spend loads of money on no point. So at the bottom of page 8 on the right hand side there's a little sort of maroon coloured thing here. It's called Sam's Story, and that's from the King's Fund. It was already done. It's a really nice little animation that shows basically how care sort of works now, where you're running around as a patient and you end up in care. Sam represents a person who, an elderly person who ends up in hospital, and then it says at some point in the middle of this little video, it says it doesn't have to be like this. What if it was like this? And it gives a vision of and we use that story and another similar one at the start of all of our wider groups when we have a new group coming together, just to remind people this is why these things are done. So we're happily using all sorts of good stuff that's out there that makes the case for what we're trying to do.
So can I just clarity on that? So the purpose of the toolkit is to enable everybody to understand why services are being integrated and what that involves.
Yeah, there's a little bit on that, and then the real purpose of the toolkit is for people who want to do that work, so they don't have to go through the same planning processes all over again. So it represents the agreement of all of the members of North West London, so the 8 CCGs and other planners, what they would like to do with each of those, primarily with each of those 5 issues: population outcomes, GP networks, provider networks, commission, finance and informatics, and how to go about it. Plus some stuff, like I said, about how to involve lay partners from the very beginning, and how to do co-production. An area where we're becoming sort of national leaders in, I think. So that's what the toolkit's for. Yeah, sorry, it's it's a big thing. We've covered quite a lot in it. It will be available. Anybody can look at it. It will be, some sections will only be of interest to people who are trying to do the same thing. But it's been carefully written, so it's accessible. I mean, that's obviously one of the principles that underpins what we're trying to do, to try and make things. Somewhere in one of the documents that Sam circulated, there's a comment about North West London's consultation document's been quite hard to follow. Part of what we're trying to do is improve that. And I think the toolkit, although it's quite dense, is quite easy to follow. You'd have to really want to do it to read the whole thing, to be quite honest. Slides 9 and 10. I won't spend any time on these, I haven't got all day really, but the story of this really is that we've got 11 projects across the 8 boroughs who are doing something called early adoption, which means they're doing a little bit more than making sure that GPs are the centre of care. Everybody has to do that, and the CCGs in North West London have all agreed that GPs have to be at the centre of the care, and the empowerment of people to take care of their own care is also something that everybody has to do. And above that, there's some things about how do we start to integrate the care like we're talking, so it actually flows seamlessly from, when you leave hospital, you're not stuck there waiting for a bed for a place to become available.
Supposing you can't get an appointment at the GP, then the whole thing goes wrong.
Yeah. Yeah, no, absolutely. I mean, what I'm not trying to, nobody's trying to say here that actually the solution is as simple as saying this is what we'd like to do. What we're trying to say is, how would we like it to be? And the next step after how you'd like it to be is, how do we make that happen? So, for example, take that integrated care idea. Why are we doing integrated care? There are 2 reasons. One is that it's better for the patient and the carer. I mean, that seems to be everybody's agreed.
Do you think so? I don't think so. They mess us up and they give us a hell.
if integrated care works in the
Yeah.
vision,
Okay, I hope
that's
so.
what
In the
that's what I'm
vision.
trying to say.
Yeah.
So by integration and integrated care, what we're trying to say is, I think, that when you're receiving care of any sort, effectively it's all focused on you,
Should be, yes.
and the services work in the background to
There's
make
too
that
much
journey work
stress
for
on the
you.
doctors.
So-
There's too much stress on the doctors already, let alone you want to put this on them as well.
I mean, what we
You're waiting 4 to 5 weeks for an appointment. Majority of people that get an appointment, it is now a phone appointment.
If
You
get
say
it,
what is wrong with you over the phone at my surgery. So you're just putting more and more pressure on the GPs.
then they call you and they don't because they have a lot of patients.
Exactly.
And they are life-threatening and you are 2 days without...
You know, it's not good.
And now
It's
the
not
social
good at all.
service they push to the GPs, believe me, you are in the mid and the sense.
They're under stress too
Person
much.
centre, where is the person centre? They do whatever
Honestly,
want
they
with us.
really are. I go round the GPs, they are under a lot of stress. And I mean, I'm surprised they're still doing their job to the best of their ability, because there's more patients, we're living longer. We're putting a lot of stress on the GPs already, let alone putting more care onto them.